much vitamin D should you take? Is it 1,000? Is it 5,000 IUs? Is it 10,000? That is one of the questions that I get asked the most as a nutritionist. So in this video, I am going to share with you how much vitamin D you should take, the importance of K2, the role magnesium plays, and whether you should take it with food and what time of the day. I am Robin-Nutritionist, and I support specifically women over 40 in strengthening their health, protecting their peace, and stepping into who we are being called to become in this chapter of our lives. Vitamin D. Why does it even matter in the first place? Vitamin D touches so many of our cells in our body, which means in order for our bodies to work optimally, we need to have vitamin D. People think that it's only for bones, but it is for your mood, your immune system, your heart, your hair, so many things. It's a very long list. So you would be taking vitamin D daily in order to be your best self. Yes, it comes in the sun, but we're not in the sun enough. And if you have melanated skin, that is a beautiful protective barrier, and it doesn't help you with your vitamin D. So it is an important supplement for us. The question is, how much should you take? Because you go to the store and there are different strengths of vitamin D. Again, 1,000, 5,000, 10,000. How much should you take? So here is the answer. You want to take enough vitamin D so that your levels land between 60 and 80. When you go to your doctor and you get your vitamin D levels checked, the range says if you're at 30, then you're good. And 30 means you're not deficient, but you are not optimal. 30 is like minimum wage. And you know, it's very difficult to live on minimum wage. If you want your body maximally supported, you want your levels between 60 and 80. Anything below 30, you are considered deficient and almost severely deficient. What you want to take in terms of your numbers is enough to get you to at least 60. That's the important thing, is you want to get your vitamin D levels checked so that you know where you stand, and that will inform how much you need to take and at what strength. But if you don't know where your vitamin D levels are right now, you could start off with 2,000 or 2,500 IUs as a baseline just to get started. I personally take 5,000 IUs a day. But if you're severely deficient, then taking 10,000 a day is not unheard of. But generally speaking, 5,000 a day is really a good vitamin D stores. You can take more and get yourself leveled out and then just stay consistent with your levels. Is a vitamin that is a very important companion to the vitamin D. And K2 simply helps to get the calcium and the vitamin D into your bones away from your heart. If you don't have the K2 as the chauffeur or the conductor, then it doesn't really tell the calcium and the D where to go in your body, and sometimes it can end up depositing in places that we don't want it. What's a safety net for us? You would not use D3 with K2. If you are taking a blood thinner or you're on dialysis, you want to check with your doctor because the supplement may interfere with some of the medications that your doctor is prescribing. So just a word of caution is to check with your provider. And then magnesium, a lot of people don't know this. Magnesium is necessary in order to activate vitamin D. You can find magnesium in cashews, leafy greens, dark chocolate, but as a woman over 40, this is a supplement that I very often recommend and I personally take. Magnesium helps vitamin D to be activated. If you're not taking magnesium or eating enough magnesium-rich foods, then your vitamin D is not going to work as well. When is the best time of the day to take your vitamin D? Vitamin D helps with energy. And if you want energy during the day or the afternoon, my suggestion is that you take it then. You want to make sure that you take your vitamin D K2 with a fat source. And that could be avocados, it could be eggs, it could be nuts, it could be olive oil. Some supplements have a carrier oil in the encapsulation in the pill. Necessary Nutrition's vitamin D3 does not have any oil in it. So that means you need to take it with food, a food that contains fat. And the oil is not there for good cause because some oils are inflammatory in nature. They go rancid sometimes. So our cleanest formula for that has no additional oil. So you want to take it with food that contains fat, preferably in the morning or in the afternoon. The last 2 pointers I want to cover is how do you know if it's working? It's important that if you take your vitamin D and if it's low and then you are consistently supplementing 4 months later, then you should see your numbers going up. 3 things may happen that will prevent your numbers from going up. 1 is you're not taking it consistently. 2, you're not absorbing the vitamin D, and that is a conversation about gut health. And the other is you're not taking it with food and you do not have magnesium with it. So if you are not taking your vitamin D consistently or with food and with those cofactors, you may not see your numbers increase as you would want it to, but that rarely happens, especially if you're taking Necessary Nutrition's D3K2. And just lastly, I just want to review the common mistakes that women make when it comes to vitamin D. One of the things is just not getting tested. Do not allow your provider to say, you don't need to get tested. And if your numbers come back at 30, they're going to say, you're fine. Know that you are maximally supported as a woman over 40 when your numbers are between 60 and 80. Also, consider incorporating K2 with your vitamin D. Also magnesium glycinate. I've done plenty of videos about that. Magnesium glycinate supports vitamin D, but it also supports our nervous system and our stress response and our sleep. It's real good stuff. And then the last 2 mistakes women make is not taking it with fat and then not taking it at all. Vitamin D is one of those #1 supplements for us as women in the pause phase. That's perimenopause, menopause, and beyond. So if you're not taking vitamin D, OMG, why? And then, of course, I'm going to invite you to take Necessary Nutrition's D3K2. And we also have forms that don't have the K if that is what you need. I want to invite you in the down description. You can find the link to grab your Necessary Nutrition D3K2. And if you need a lot more support or a little bit more support, we have a community specifically for women who are dedicated to strengthening their health, protecting their peace, and connecting to who they're called to be in this chapter. I'll put that information down below as well. So eat well, think well, and be well. This is Robin from Necessary Nutrition, and I'll talk to you soon. Peace.